So for those of you who don't know me, I'm Christine McWilliam, and I've been with the Alzheimer's Society now for quite some time. And I've been running our webinars for also quite some time. My tech support online tonight is Jennifer Sims. If you need any support at all, please feel free to reach out to her or to just type something into the chat and one of us will give you a hand. So I'd like to begin today by acknowledging the Indigenous peoples of all the land that we are on today. While we meet today on a virtual platform, I would like to take a moment to acknowledge the importance of the lands which we each call home. We do this to reaffirm our commitment and responsibility in improving relationships between nations and to improving our own understanding of local Indigenous peoples and their cultures. From coast to coast to coast, we acknowledge the ancestral and unceded territory of all the Inuit, Métis, First Nation people that call this land home and endeavor to move forward in a spirit of reconciliation and collaboration. So it seems like things are getting back to normal more and more, and I'd just like to remind folks that we are open. Most of our offices are open fairly regular hours now. Some people are still working remotely part-time. So please call should you need to connect or need any of our services. I'd also like to just take the time to say thank you very much for taking time in your evening to join us tonight. We very much appreciate the support that each and every one of our clients give us, so thank you. This is the first of our fall lineup of webinars, so please check back or please check your email often as we'll be sending out more reminders. Everyone probably saw that there was a recording note at the beginning. Just want to remind people that it will be available tomorrow on our Ascent Cafe for viewing. And as I said, please feel free to use the chat section. If you'd like to unmute yourself, please just raise your hand first, and we will definitely get to you as one of the hosts. We will be doing a Q&A section after Ryan is finished his presentation. So if you have any questions that you'd like to write down and ask afterwards, that is when we will get to that portion. For those of you who are on social media, we are social, and these are our social platforms. This is where you can keep up to date with all the society action. I just like to remind people in all of our webinars, this is not medical advice. We would always ask you to seek out the advice of your medical professional. So we always just like to mention that as a disclaimer. And so now, without further ado, I will present our speaker for this evening. Ryan is a registered social worker, having joined the office of the Alberta Health Advocates in 2010. Ryan has spent most of his career working with people in marginalized positions, specifically with people with health and mental health concerns, and has worked in other government roles, such as income support, as well as nonprofit and for-profit groups. Group homes and day programs in various agencies, long-term care centers, and other non-government social service organizations. He has served on several special interest committees, such as Healthcare Ethics Committee, Social Workers in Health Committee, and a specialized senior issues working group, as well as having input on a wide range of subjects related to healthcare, housing, addiction, mental health concerns, and poverty. He is currently one of the managers of the Office of the Alberta Health Advocates. So I would like to say welcome, Ryan, and thank you for your time this evening. I will stop sharing and let you take it away.
Thanks very much. I'm assuming you can see and hear me?
Yep, we can definitely see and hear you.
It's quite the bio. I don't know who wrote it. If it was me, it was many years ago, and most of those things I barely remember. But it does reassert that that hopefully I have some value, and in terms of the information I'll share here today. And I appreciate being invited for the first in the fall lineup. I didn't know that. So I really appreciate you guys taking the time to have me with you here today. I am new to the group. I don't think I've ever presented or been with you, so I'm certainly excited to get to know the group a little bit and try to answer some questions. If I don't have the answers, certainly I will be willing to take it away, think about it, and come back. So please don't be afraid to ask, and hope you have some grace and forgiveness for the things I may not know, which is probably a lot. So I'm going to share my PowerPoint here. Just bear with me.
And Ryan, while you do that, yeah, absolutely. We wanted to invite a presenter where we thought it would be relevant to recognize World Alzheimer Day, which is today. So we thought that this was an appropriate way to kick off our fall lineup. So
fantastic, fantastic. Okay, so I have a very short PowerPoint to be clear, and so I don't know if we want to save questions to the end. That's fantastic. But if it's something burning or you need to ask for some clarity, please do. I'm just going to turn off my video while we go through the PowerPoint, and I think we have about till 8 o'clock. Is that correct?
Yep, that's right. We have till 8 p.m. So lots of time if you have a short presentation to get to lots of questions and answers.
Perfect. Okay. So I'm from a place called the Office of the Alberta Health Advocates. We are here stationed in Edmonton. We're a small group of people, or were up until a few weeks ago, 14 in total. That includes myself as the manager, several frontline staff, 6 or 7 that answer the phones, take calls, emails, faxes, those sorts of things, an advocate, and a few admin staff. We are actually growing, and I'll get to that in a few minutes. What is the role and purpose of our office? We are comprised of 2 advocates. An advocate is a tricky word, as I'm sure everyone's aware of. We are essentially appointed advocates by government, and I do, in fact, work for the health department. So we have 2 advocates established under the government of Alberta. One is the health advocate, and one is the mental health patient advocate. The mental health patient advocate is something I'm only going to briefly mention today, because for the most part of this discussion, I suspect it will not apply. However, in the Q&A, please just ask questions if you have them. So briefly, the mental health patient advocate has been around since 1990, so it's not new. Both advocates are independent from the health authority, so that's Alberta Health Services or Covenant Health. We're arm's length from the ministry, and we report to the Minister of Health and submit an annual report. Basically, what all that means is we're a mediary between Alberta Health Services and the Ministry of Health. And our goal is to take patient and family concerns, suss them out, break them down, and help people navigate to where they need to go to find a resource. So maybe this organization, or to lodge a concern or complaint. Oh, I've been asked to start my video, so I'm doing that. To lodge a concern or complaint, navigate services, provide resources, and in some scenarios, review concerns and complaints. And I'll get to that in a moment. Okay, so Office of the Alberta Health Advocates. So a lot of system navigation, promotion of something called Alberta's Health Charter. I'm going to get to that in a moment. Education, connection to resources, reviewing and investigating complaints, and a lot of coaching and listening. So what does that look like in practice? Our staff will take a phone call, any Albertan, on any health related topic. Hopefully it's health related. And where we're different from, let's say, an organization like 811 or 211, any of those phone lines, is we're spending a lot of time assessing that phone call, listening, providing some coaching and tips. So maybe it's, how to have a better conversation with your physician. Maybe those conversations haven't gone well, or you haven't received the support, or you're on a wait list for continuing care. We may not know those answers. In fact, we often don't, but we explore the issue, try to find answers, bring that back to the individual. So it's not necessarily a 5 or 10 minute phone call. Sometimes it's 45 minutes, numerous phone calls over, days or weeks or even months. So it's a bit of a relationship that we work on. Health Advocates specifically is there to provide education and awareness of Alberta's health charter. I suspect if I took a poll of the room, probably most people in the room have not received any sort of education or aware of Alberta's health charter. I see that as a misstep or almost failing of our office. It's something we really haven't been able to promote because of many, I guess, circumstances. And that's something we are working on now as an office, with expansion of staffing and kind of a jurisdictional scan as to what is missing in Alberta. And it really is that a bit of authority behind the person-centered perspective, patient perspective, family perspective when things are going wrong in the health system. What can we expect to improve? So a lot of the work we do is just around that education of the health charter, reinforcing it with service providers, Albertans, and ourselves. I'm going to get to what that means in a minute. And the other piece of our work is navigating existing health services, referring to the appropriate complaints resolution body. What that means is when an Albertan calls us and they have a concern they want to express, and they've tried to address it, let's say in continuing care or a long-term care home, they've tried to address it with a nurse or a manager or the director of care, and that hasn't been resolved, we look at what complaints mechanism exists that that person can bring that concern or complaint to. And we have a legislated and mandated role to assist with that. So that may be a telephone call, that may be a contact with a colleague over at the appropriate governing body. When people have a concern with let's say a physician or a service they were provided by a physician, we would connect them to the College of Physicians and Surgeons. If it's a social worker, the Alberta College of Social Workers. If it's, let's say, a hospital or a program or a service or long-term care, that could be Alberta Health Services Patient Relations. So we have some, hopefully, expertise in connecting people to those services and supports. When there's a lack of a complaint mechanism, so a lot of the time that would be a private health facility or an independent doctor's office, and the complaint may not necessarily be specific to the doctor, we would actually have a responsibility and the legislative authority to review that concern or complaint. And that's key because we're the only organization in Alberta that has the authority to review a complaint where no mechanism exists, and when it's not a public service. So as an example, if it's a private healthcare provider, we still have that authority, whereas the Alberta Ombudsman has limitations in that way. Okay, so what is Alberta's health charter? Well, it's a one-page document, almost a draft document in a way. It was created in 2014, and the rumors are is created on the back of a napkin by some MLAs and such, with the idea of how do we create a province and health system that is more responsive, patient focused, and aspirational to creating guidelines for Albertans that will improve interactions between Albertans and their healthcare providers. It does not set out rights. So it's not something, when you take a peek at it here in a moment, it's not something that you can say, well, I have the right to, therefore it hasn't happened in my case, and you need to make it happen. It's more of a conversation piece. The perspective in the charter is that it is a conversation and a partnership between the health provider, the patient, the family member. All jurisdictions in Canada have some version of the health charter. Some of it is legislated, some of it is by the board. So as an example, Alberta Health Services. And the aspirations of it are the same, to really improve those relationships between care providers, patients, and families. So I'm just going to move ahead here. This is the charter. I'm going to talk a fair bit about the charter. I'm assuming there'll be some questions around it. So as you can tell on the screen, it speaks to things such as having your health status, social and economic circumstances, beliefs and values acknowledged, having requirement to be treated with respect and dignity, confidentiality of your information, being able to participate in your healthcare, having access to your medical records, receiving information on the health system and education about your best ways to live healthily, I suppose. Reasonable, timely, safe access to healthcare. We get a lot of concerns about that. Having the opportunity and ability to raise concerns without there being any retribution. That's a big one. I mean, people have valid concerns, sometimes complaints, questions, and often the concern that they call us about is that they were trying to lodge a complaint or a concern, and they felt that the service their loved one or themselves received as a result was inferior because they brought up a concern or a question. And that's obviously, it's not right, but we also analyze and determine what we can do about that. And sometimes it's just bringing in the charter to those conversations. Sometimes we will connect with the facility or the person. Sometimes it's just coaching, right? So there's a lot that goes into what you do about it. There's also expectations of the person in relation to the charter. So it's also about respecting the rights of the care provider, making sure that we're asking questions and working with providers to understand the information that's being provided, treating health services as a valuable public resource. So a lot of that is about self-education, right? Things like this today, you guys are all being provided hopefully a little bit of education, or at least some moments to think about when you interact with the health system. What is the best way? What sort of advocacy pieces can I take away, not necessarily from me, but from your colleagues and people on the call here? One thing, like, I'm just going from the top of my head here, is a lot of people will go to their family doctor and want to spend an hour and a half with them with 20 concerns. Well, that is not usually realistic with most doctors anyway. So it's about, how do we break that down? How do we ask those key questions? What do we make a list? Do we bring our medications in? Do we determine what needs to be addressed now versus 3 weeks down the road? Talking about breaking things down into second, third appointments, being assertive in your communications with medical professionals. So a lot of people, you're probably, I don't know, can't see everyone. Maybe there's a few eye rolls because you know all that, but a lot of people don't, right? So in our office, it's really discussions around those things when people call. I think that's it for the charter. I'm going to move on. There's a link to it here, and for folks that aren't able to pull it off the PowerPoint, just connect back and I'll make sure you get that. I'm going to briefly talk about the mental health patient advocate. So again, 2 advocates in our office. Health advocate covers all of healthcare in Alberta, private, public, no really definition of what is healthcare, so sometimes that's tricky. But if you have a concern or need navigation or referrals, we are obviously one body, not the only body to contact regarding that. There's a sliver of people in the province that at times will fall under the legislation of the Mental Health Act. Not a big population, but in terms of the numbers that come to our office, it's over 50%. So it's a large part of the work we do, and it's more my area of expertise in a way. So the Mental Health Act covers people that need to be brought to the hospital hospital against their will and are detained. So that's usually a very small percentage of people. You may or may not ever know of anyone that ends up detained under the Mental Health Act. But if that's necessary, and there has to be specific criteria for a person to be detained, there is authority to have people brought in to the hospital against their will. And as part of that authority, there is a advocate set up, our office, to investigate those patients or family members' concerns, care, and treatment while that person is detained in the hospital. To be detained against your will as a person who's not voluntary, you have to be under what are called admission certificates. You could be in the community under what's called a community treatment order. So the role there is to provide rights information to those patients and families, provide options, and to investigate concerns and complaints. I'm just going to skip this, but I guess the second bullet is important for everyone. It's we're an objective third party. We're a resource for families, patients, staff. We can explain processes both under the Mental Health Act and in various other settings. Continuing care, that is not my, as much as I did work there once, it's not my area of expertise anymore because so many things have changed. When we have a call or a concern, we suss out the root cause of the problem. We help navigate for families, people that are calling a solution, and connect people to those solutions, or at least that's the hope. These are just some general stats. I think this was the first quarter fiscal year. So how many files do we open? We probably open about 2,000 a year, to be honest. In terms of what those discussions are around, 30% around provision of rights information under the Mental Health Act, about 26 to 30% are around system navigation, 20% connecting people to referrals, and the rest is informal investigations, inquiries, and reviews. So that's thousands of hours just listening to Albertans and help navigating their concerns. And that's about it. This is our contact information. That's a very brief PowerPoint, but with intent to hopefully spend time on questions that people may have about the health system. So I'm going to open it up now.
Yeah, absolutely, Ryan. And it's like you said, short and sweet, which is perfect because leaves us lots of time for questions. While people are maybe gathering some thoughts about what they would like to ask, I did forget to mention in my opening statement that participants tomorrow will receive a survey that Ryan and his team at their office are looking for feedback on. It's very short, very very quick. We'll just take you a few minutes over your morning coffee tomorrow. If you would have it, or if you have a chance to fill that out, that would be great and greatly appreciated, I'm sure. Yeah, Ryan, maybe did you want to add a little bit why you would like people to fill that out?
Yeah, thank you. One of the reasons is we've never worked with you folks before. So I'd love to hear, do we need a longer presentation? What would be helpful to hear if we were to present again in 6 months? What sorts of things do you want to know? What did I cover enough of, and what could I have expanded upon? We are hoping to grow in size and provide better services to all Albertans and become more involved in the things I've talked about, navigating concerns, complaints. So giving presentations that are effective and useful with the idea of helping people become more connected regarding their care. So anything that you feel may lead us in that direction, we'd appreciate it.
Yeah, absolutely. And this being a new beginning of a partnership between us and you at the Alberta Health Advocates, we're just another tool in your toolkit, and vice versa.
Exactly.
As we had kind of chatted about when we first met, that there wasn't much of a connection in terms of people living with dementia. But why isn't that? Because we certainly hear a lot about how it would be nice to have an advocate on family sides for various things that you mentioned over your presentation. So yeah, like I said, does anyone have a question they want to ask over the mic, or they want to ask? I'm going to put it to gallery view so I can see everyone's faces. Okay, so I do see one hand at
Mew.
Mew, sorry, my apologies.
Just like a kitty cat. I was wondering, I didn't, unfortunately, because I have a husband with dementia and I had to get him in front of the television with the soccer game, keeping quiet for 3/4 of an hour. I missed what your affiliation is. Is it with AHS or is it with some independent body?
Really good question. So we operate at arm's length from the government of Alberta. So if you can imagine, I guess, two islands, one being the government and one being AHS, we're kind of like a boat that goes between the two islands, delivering messages, trying to bring people over to either side. So our best function is really in supporting the patient and family voice. We don't have a big stick most of the time. Like even in our legislation that says we can review and investigate, the goal behind those reviews and investigations is purely to provide information and make recommendations. So our best work tends to be in really breaking down the concern or complaint, bringing it to the people that'll listen, hear, and have some authority to resolve it. So in terms of who we're affiliated with, formally we're with the government, but because our primary function is to express the patient and family voice, it makes sense that we're arm's length so we can advise government that this is what we're hearing from patients and families. This is what their concerns are.
I asked the question because I got a lady called Gwen, and I don't know if that's on your staff, that was an AHS patient support person, who was brilliant.
Oh, good. That's nice to hear.
Absolutely brilliant. Is she with you?
No, but
Oh,
I can probably guess. So what would happen? Let's just have a quick scenario here. If there were a concern with, let's say, someone that had dementia and maybe they weren't getting the care that they were requiring in the community, and home care was involved, and you spoke with the home care provider and home care really wasn't receptive to the concern or complaint and went through kind of their management structure, it could go to what's called Alberta Health Services Patient Relations. I suspect that's who you may have spoken to, and they have a whole complaints process where they will analyze and review, or should be reviewing, that concern. At the end of the day, that process can be actually reviewed by the Alberta Ombudsman. So I suspect you might have been involved in that process. Hard to say for sure, but I'm glad that whoever it was helpful. And we do find most of the time that's the case, but obviously there's hiccups all along the way at times. So, we try to, as an example, if Gwen, let's say she's from patient relations, I'm guessing, it wasn't helpful, and maybe you called us back, we may end up calling Gwen to just say, hey, did you talk to Mao? Did you work with her? Do you know what may have happened in this complaint? So we will look at those things.
Yes, it took her a while. It took her 3 1-hour phone calls to understand that what I was saying was actually correct, because every time she took it back to AHS, oh, no, that doesn't happen. Oh, no, that's not correct.
Oh,
and
wow.
I kept, well, this is the way it is. And she was like a dog with a bone. So if I had not succeeded with her, I could have come to you to get some more assistance.
Yeah, and actually what I would say to everybody on the call is, if you're ever with practically anybody in any concern or complaint, this is about being an advocate in one way, is almost everyone has a boss or follows a process where a concern or complaint can be escalated. And generally speaking, you just have to ask in a polite, constructive way, how do I escalate my concern if you're not able to resolve it? Or is this the final step in the review process? process? Are there any other options? Because more often than not, what I find at patient relations is maybe a family member was working with them and they got an answer. Maybe it wasn't fulsome, or they wanted more information, or they were concerned about the answer they got. And they either didn't understand or weren't provided information about how to take that concern or complaint higher. And you most certainly can, all the way up to what's called the patient concerns officer, and beyond that, the Alberta Ombudsman, who looks at whether or not a concern or a complaint was handled fairly and in line with the process that is set out to review it.
Well, that is very good information, because I will get in touch with you privately.
Yep, that's
I will
fine.
phone you tomorrow, because I won't take everybody's time up now. But thank you.
You're welcome.
Oh, well, great question and great conversation that came from that. There's definitely a couple things coming in on the chat, Ryan.
Okay.
Someone just said, thank you. I have no idea this intermediate process existed. Your question, so is there a governing body that handles complaints? If you disagree with their decision, does the Alberta Health Advocate help with communication/resolution with the governing body? For example, complaints/concerns about continuing care.
It's a really good question. So because we're required in our legislation to refer a complaint to a body that exists, if one exists, the short answer is not often, but sometimes. So, so if a concern is about, I think, did you say continuing care? Sorry, I forgot already.
Yep, no, about continuing care.
Continuing care. So if the concern is about continuing care, again, typically, ideally, and being a former social worker in continuing care, be ideal to bring it up to the management staff there. Presuming it has gone that route, then you would call, normally, if it's a publicly funded, which most are, you would contact Alberta Health Services. You could lodge a concern or complaint through the patient relations department. And at the end of the day, that would actually go to the patient concerns officer, who has a regulated process. And after that, the Alberta Ombudsman, which has oversight over patient relations. They have oversight over all the regulated health professionals, so nurses, doctors, occupational therapists, social workers.
Great. Okay, moving along. So another question is, can you explain the difference between the Alberta Health Advocate and the Provincial Clinical Ethicist Service?
A little, yeah. So one thing to know is we are not clinicians at all. So if you, and in fact, we don't even take much of a stance on issues aside from hypothetical. So I don't know if your loved one should stay at home receiving home care or needs to go into assisted living, long-term care. We're not clinicians that can make that judgment. So carrying that thought process through, we don't have a position on clinical matters such as an ethicist would. Our role is purely making sure people are connected to resources, including complaints bodies, making sure that they're able to take some steps around advocacy, but not in terms of an ethicist review. I did sit on an ethics board myself many years ago. Very interesting, just as a community member, but no, we don't have that expertise. Just keep in mind that we're not clinicians. We're there as that assistance in navigation.
Yeah, and I mean, we could even say the same thing at the society here, is that most of us also come from a social work background or some sort of social service background. Hence why we also do mention at the beginning, this is not medical advice.
Yeah.
Just really good conversation and a place to ask questions. In the chat, someone did ask how to get a hold of you. I'm guessing just your office, Ryan. So I did leave the general line and the website if people would like to take a look at that.
Yeah, thank you. the website has some value in terms of articulating things that sometimes I'm not the best at, particularly around rights, expectations, the charter, all of that. Has all of our contact information. It's not the best website. It's a Government of Alberta website. They took ours over. We're hoping to have a new one soon that is better for families and patients. But yeah, for now, that is our website. And our contact number, that is the best one to get a hold of, because what'll happen is any questions or concerns you have will be sent to one of our intake workers, who will give you a ring back, and they'll help suss it out for sure.
Perfect. Okay, you've got another question. Do home care complaints / concerns fall under the patient relation department for continuing care?
Yeah, most times they would. Patient relations department is most appropriate. Now, also in government, the continuing care division sometimes handles the concerns. It does depend. Like, for example, sometimes there's an allegation of abuse, then you would go to Protection for Persons in Care, which is under the Ministry of Health, right?
Okay. I just want to open it up to the floor. If anyone has a question they'd like to ask over camera and mic. Same thing, either feel free to use the reaction buttons along the bottom there to raise your hand, or the smiley face, or anything will catch my attention. Just want to make sure we're not missing anyone. Okay, all right. I'm going to carry on then. You have another question in the chat. What is the turnaround for the Alberta Health Advocates to get back to you? Is it live answer calls? What are your hours?
Really good question. I'd like to say it's better than it is, but we're better than we used to be. So currently it's around 2 to 3 business days for a turnaround call. Sometimes, and I would say most often, we strive to be same day. It does depend on the message left. So sometimes we have to prioritize urgent matters. So if there's, for example, not that we get a lot of allegations of abuse, but using that as an example, we'd probably call that person back from maybe before somebody else that's maybe just starting to navigate the health system. What I can say is, over the summer, our time frame to get back to people was a bit longer. It's better now, and we've just hired some new staff. Of course, they need to be trained, but I anticipate that we will be even quicker. So for a quasi-government body, it's pretty good. 2 to 3 days. It can always be better. And I wish, and I do hope to see a time where we're answering phone calls live, because it would make a big difference. Yeah.
Mm-hmm. Yeah.
Hours are business hours. Sorry.
Okay. Just the usual Monday to Friday type thing.
Yeah.
Makes sense. Yeah. And I think we all wish we had all the capacity in the world to serve and help everyone as best we could. Unfortunately, it's just not reality.
Yeah. One tip to think of, though, what I've seen on like Mondays is people tend to call us on Mondays. And if I were in a situation where I had a concern, complaint, or question, I would call, even if it's a Saturday, leave a message, because most organizations, at least in the government, kind of call people back in the order that it's been received most of the time, right? I mean, there's obviously exceptions. So if you call on Saturday, you're more likely to get a call back sooner than if you wait until we're open on Monday. So that would be my general advice to everyone working with any government agency. It doesn't necessarily hold true for every agency, but it makes the most sense most of the time. Just a little tip.
Mm-hmm. Do you take concerns via email?
We do. So if you click on that link, it'll take you to, it's essentially an email or an info sheet where you just fill out your basic info and basic concern in a secure fashion, and it'll go right to our intake area.
Do you have support for other languages?
No, I would say pretty much no. We do have some information sheets around the Mental Health Act in other languages, so that's more providing rights information. We don't have staff here that for example, speak a specific language. However, if we need to speak to someone that's called in a different language, we have the ability to hire an interpreter, and we have a service for that. It's just not immediate. But if you were to call, let's say, and indicate that you spoke a certain language, or you're the partner of someone who spoke a certain language, and that person needs to communicate with us but can only speak in that language, we would hire an interpreter to have the conversation with you. So it's not ready-made, but we would do it.
Right. Okay. Once again, I just want to open it back up to the floor. If there's anyone who wants to open their mic and ask a question. No, okay, that's okay. I know I'm a processor, and you might get a lot of phone calls in the coming days and weeks there, Ryan.
That's okay. Like, one of the things, and I would encourage that, and keep in mind, if you've got nothing out of this presentation, keep in mind that one of the reasons to call us, if not the main reason, is just to say, hey, I got a thing I'm not sure about. Can I talk it out with you, right? And we may or may not have the answer, but we're a voice on the other end of the line. We'll try to pick it apart with you and come up with a strategy or a solution. So there's no, poor questions or questions that you're like, I don't know if they really do this. Even if we don't, we can at least have that conversation and try to figure that out.
Yeah, absolutely. Monica, do you have a question? Here, I'm just going to ask to unmute you. You just want to hit yes. There we go.
Hi, I'm so sorry. I
No,
missed
that's
the
okay.
frame where the contact information for Ryan was listed.
So that's in the chat section, and it's just the general line and their website, which does have, and actually, maybe Jen, can I get you to pull the actual email address? I'm assuming, Ryan, it's probably just info.
My problem is
Mhm.
I just got a new computer and I couldn't open you up on the computer, but it opened on my telephone and I'm completely lost. So this whole thing is being recorded though, right?
Yes,
Yeah.
absolutely. And it will be available to view tomorrow.
Okay,
So,
then I
yeah.
can get it tomorrow. Sorry to interrupt.
No problem at all.
For the direct
Please.
email address for everyone, it's I'm going from the top of my head. It's info, INFO, at albertahealthadvocates.ca. So advocates with an S. That's one of the best ways, or through the website or through the phone number.
Yeah.
Thank you. Could you mute me please again?
Sure, no problem. Excellent. You know what? There again, no question is a bad question. So thank you. Okay, so you do have a couple more in the chat. If I had a concern, complaint, question, would you recommend that I tell the department I have a complaint against that? I have a complaint against, and that I've contacted the health advocates.
Oh, that's a good question. I think if you're talking about if there's a risk to telling the organization or body or department that you're calling the health advocate, I hope not. A couple of reasons why. We work in a conciliatory manner. We're not there to get people in trouble. We've never had anyone fired, more or less. It's just saying, okay, there was that one. But that's not our goal. Our goal is to really be conciliatory, collaborative, find solutions. So most people that are aware of our office, if you indicate, I've called the health advocate because I have extra questions or have a concern or a complaint, I'm hoping they wouldn't get their back up against the wall. It's hard to say with human nature, but that would be my hopes. We don't see a lot of that. We don't see a lot of resistance, and I don't know how many times people say that they've called the health advocate. To be fair, but I think you have every right, and there should be an expectation of the service provider that if they're not able to answer your questions or concerns, that you might want to reach out to the health advocate, and you have that right to do so, and that's why we exist. I think if you're having a productive, proactive discussion that that you're finding hopefully helpful, and those that goes back to some of the advocacy tips, like talking in a calm manner. Hopefully, let's say you're talking to your physician, and they're hopefully talking in a calm manner back to you, breaking things down, explaining why you're concerned, asking what the options are. Those are kind of all skill sets that obviously not everybody has. Hopefully most do. That helps alleviate any sort of concern or complaint, but at the end of the day, sometimes it's just a concern that needs to be reviewed. And yeah, at that point you might want to say, I've contacted the health advocate. So that's a bit of a long answer. Another way to answer that is we do have a lot of people that CC us into their emails. So maybe they've written the health minister. Let's say wait times, right? Everyone's concerned about wait times. Everyone's concerned about doctor shortages. So often we'll be CC'd in to an email, a letter, and I think that's completely appropriate. Why not? Number one, it helps us understand and gauge what's happening in the province, and number two, it helps us watch for that stuff and then provide more information to either Alberta Health Services or the ministry as to what people are feeling and saying.
Mm-hmm. Well, and I think further to that too, Ryan, if you put the lens of dementia on top of that, often people, I would say, or when they're looking for some type of advocacy or a liaison or someone to just help them navigate, it's possibly because they've reached the stage of care. Yeah. And maybe they're not getting the answers they're looking for. Maybe they're not getting the type of care they hoped they would be getting. And so then it's a question of, let's say you have brought it to the home care and they turn around and say, well, there's not much we can do about that right now. So then it becomes a question of, if they reach out to you, how does that affect the care of the person that is living with dementia?
Yeah.
What does that look like?
Yeah, it shouldn't.
It shouldn't. Right?
It shouldn't. I think we all know that. I haven't seen any evidence that it does. So if I just take you through an example, I do have someone living in some sort of supportive living as a family. 2 different units, had some concerns with home care, quite serious concerns, and we worked back and forth between the family and home care. The complaint had already been lodged with home care prior to them lodging it with us, and they wanted to complain about home care, did so to us. And as much as I'm sure home care was a little bit frustrated that they went to us, we were able to proactively navigate the issues. And as the individuals did have difficulties interacting with home care in a positive way, we were able to interact in a positive way that really helped get to the issue without both sides getting kind of their backs up against the wall. So if that's an example, I hope that helps. And that's what we would hope for any situation.
Yeah, and I think that definitely could be a really good example of, if when someone is living with dementia, oftentimes, and fair enough, they don't want someone in their home caring for them that they don't know, they've barely met. Mm-hmm. And then that's where the issues start to come in, is why can't we get a consistent person? And, so there again, in all areas, I'm sure, of your job, it's very convoluted, but just putting the lens back on the dementia side of maybe why some of these questions have come in, just a little bit more of where people might be coming from.
For sure. Another example was there was an individual that had dementia and had, things changed. Everyone on the call probably knows that. Things changed. The individual had become a little bit angry. Home care had indicated aggressive. The person had become a little suspicious. The home care used a different adjective. So, right from the jump, it was different interpretation of the events, and then eventually the service was refused. So when we got involved, as much as our role is to refer that individual or that family to patient relations, we also said, okay, what's really going on here? Because we're hearing from 2 different sides about one incident that really shouldn't have become so over the top, and two different interpretations of what happened. So a lot of it was around fear of the actual home care worker that was going to the house versus the expectations set out by home care management. So we were able to work through those difficulties, even though it's a bit more hands-on advocacy than we would typically do, because we don't really have the jurisdiction and leeway to kind of do that individual one-on-one in that sense. But in that case, it became important to do it. And then we handed it off to Alberta Health Services, and they were able to facilitate the rest.
Yeah, well, and just even back to your earlier comment, maybe one day we'll be CC'd on your emails.
Absolutely, that's fine.
Yeah, if you have a situation where someone's living with dementia, there again, that's what builds these systems, these interdisciplinary pieces to our healthcare that only makes it better.
Yeah, well, I mean, even just a quick peek at your website, I think last week shows that you clearly have the expertise and knowledge in so many areas. We don't have it, right? And for us to even try to get it, well, it'd probably take years. So yeah, you being CC'd in we're probably going to need to reach out to you, and so I hope everyone on the call knows that I might be reaching out to. Is it ASANT? Is that how you pronounce it? ASANT?
We do go by AS/ADNT.
Okay.
Yeah, ASANT is an acronym that not many people tend to realize is us.
Gotcha.
Yeah. Well, and there again, back to your other point, our expertise comes from the folks on these webinars. They're the ones who teach us, and that's where a lot of our learning comes in.
Yeah.
Absolutely.
Well, I saw all your work about patient-centeredness, and that's really the lens that we are trying to apply to everything. Because I know working, for government, arm's length or not, often it's very system-focused, even though with the best of intent. So we're really trying on our end to switch that and say, okay, we know what the program's requirements are. We know what you're saying. We know what the limitations are. This is what the patient is saying. This is what the family is saying. How can we get this going in the right direction?
Absolutely. You have a couple more things in the chat, and I think we're doing really good, kind of right on time here. A couple people had just mentioned, thanks for offering this presentation. They had no idea that you existed, so I think it's great that we can bring some, bring you out to a new crowd. One person's wondering if my apologies, that's my Windows 10 or Windows 11, if anyone can hear that. So sorry about that. If I live out of province, but my family member lives in Alberta, can I reach out to you?
We have had calls from India. We have had calls from everywhere on the planet. So you can always reach out to us. Obviously, we're limited to assisting people that are in Alberta. From a jurisdictional standpoint, but why wouldn't we, let's just say your family's in BC, why wouldn't we have that same conversation about maybe some suggestions if it was about, how to get into care? We'd probably still try to find that, phone number or what have you for you. If families in Alberta, and often I think what tends to happen for families in those scenarios is it's trying to have their loved ones move to the province they're in, or they're trying to move into the province. So we certainly try to navigate those types of concerns. And yes, you can call us. Short answer.
Perfect. So if I go visit my person in care and I notice there are other people living with dementia not being treated well, can I call confidentially on their behalf? Who supports those that don't have family to advocate for them?
Yeah, well, the first answer is yes, you can call us, always can call us. You can also call Protection for Persons in Care if you think there's any sort of sign of neglect, and you can call them confidentially. When they do an investigation into a concern of neglect, they may need some information. I'm not too sure. From our standpoint, because we wouldn't typically have the investigative ability in that scenario, we might need to refer you to either patient relations or protective services, we would look at it from more of an advocacy perspective, maybe speaking, let's say if it were a confidential call to our office, we might speak to the management at the facility, depending on how the call came in, and said, hey, we received this anonymous tip call that this was happening. What are your thoughts to it, right? We might also directly report it to Protection for Persons in Care, depending on how the issue came in, and then let them handle it. We really look at, with every phone call, where is our jurisdiction? I mean, as a social worker and as a human, I'd love to help in every way for everybody, but we have to work within, the law and what we're allowed to do by government. So we have to look at the other resources that exist and who's most appropriate to help.
Yeah. Okay, you have two more, so I'll take those two questions, and if there are any that come in after, Ryan, would you be okay if I forwarded those on to you and
Absolutely
answer them? Okay, great. If someone living with dementia is on their own and needed support navigating the health system, is that something the health advocate could support?
Yes. So the important thing to keep in mind, similar to what I previously said, is our sources and ability to navigate is typically through phone, email, fax, conversations. We don't, for example, go to doctor's appointments with people as much as I'd love to. We don't do that type of hands-on navigation. We may find someone for you that might. So there's a organization in Southern Alberta, maybe you're aware of it, called Open Arms Advocacy. They may do that type of hands-on work. I know they've changed from year to year, but that would be an organization. We might contact you folks to see, hey, do you have any options? Or the disability advocate. So we will make those calls, but we don't do that kind of hands-on work that I'd kind of like to do if it was a free-for-all in terms of my abilities. So, but can they call us? And yes, absolutely.
Perfect. Okay, and your last question. Do other provinces have services or similar to them currently supporting my mother on the East Coast?
It's a really good question. I don't want to answer and be wrong here. I think every organization, every province and territory has some sort of advocacy service in different scenarios, but I don't know if there's an official health advocate. I know in terms of our structure that we were supposedly the first one in Canada, so I guess that's a bit of a feather in a way. I know under the Mental Health Act, every province has some sort of investigative body to look at concerns and complaints of people that are detained. So I would suspect that there's a process to review concerns. It just might be different in every province. I know in most provinces, they have something similar to Alberta Health Service patient relations. So that might be the board, that might be directly employed by government. So those do exist, but do I know each avenue? Not exactly.
Okay. Like I said, that was your last question. So I think this is a great place to end. We're 2 minutes underneath the hour. And yeah, I'd just like to say thank you to everyone for joining this evening. It was great questions, great conversation. I'm so glad that even if we could inform one more person that your services exist, Ryan, we've done our job. So thank you very much as well for your time this evening. Yeah, did you have any closing remarks?
No, I really appreciate the opportunity to get you know a little bit. You'll certainly probably see your name CC'd into a few of our emails over time, but we promise not to inundate you. And hopefully, if for anyone that is emailing in the next couple of days, we're able to answer your question and not just refer it back to this organization. We try not to do that. We really try to help find answers, and I hope to be able to do that for anyone that needs to call us.
Okay, and my tech person, Jen, just asked if there's any way we could get brochures for our offices from you.
Yes, if you just send me a brief email so I don't forget, because it's 8 p.m. I can do that. The only problem is we don't actually have proper brochures. That's my caveat. So we have some on the Mental Health Act side because we put them in hospitals. It has our contact info, but people may be raising an eyebrow depending where you put them. We're happy to give them out. We're happy to send you copies of the charter, which might be more helpful, and information. But it is limited at this time. Hopefully by this time next year, we'll have a full resource and promotional suite out there.
Okay, that's great. That's really good to know. All right. Well, once again, thank you very much, everyone, for your time this evening. And thank you again, Ryan, and hope everyone has a wonderful rest of their evening.